Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the anticoagulant drug heparin and warfarin. Are the two traditional anticoagulants. They are used for the acute coronary syndromes, deep vein thrombosis, pulmonary embolisms, and heart surgery. Thrombus, a blood clot that forms abnormally within the blood vessels. Embolus, when a blood clot becomes dislodged from the vessel's wall and travel through the bloodstream. It is also given to certain peoples at risk for forming the blood clot, such as those with the artificial heart valves or who have the arterial fibrillation. Warfarin is an oral medication. It is synthetic derivative of the coumarin and a chemical found naturally in many plants, and it decreases the blood coagulation by interfering with the vitamin K metabolism, and it stops the blood from clotting within the blood vessels, and it is used to stop the existing clot from the getting bigger and to stop the part of the clot breaking off and the forming emboli. As in the PE, the most common side effect of warfarin are the bleeding and bruising. The bleeding can be in the form of the prolonged bleeding from the cut bleeding that does not stop by itself. Treatment is monitored by the regular blood testing using the international normalized ratio, and which is a measure of the how much longer it takes the blood to clot when oral anticoagulant drug is used. Warfarin inhibits the effective synthesis biologically active forms and of the vitamin K dependent clotting factors. Second, there are the clotting factors 7, 9 and 10, as well as regulatory factors protein C, protein S and the protein Z. They are the dabigatran etextilate. It has developed by the Boehringer Ingelheim. There are the new oral direct thrombin inhibitor and the prodrug of the dabigatran. Dabigatran is a small molecule that reversibly inhibit both free and the clot bound thrombin by binding to exosite 1 or the active site of thrombin. Rivaroxaban, there are the developed by the Bayer. Rivaroxaban is an the orally available small molecule active site directed from the 10-8 inhibitor. There are the no significant interactions between food, antacid, digoxin, aspirin, naproxen, and the rivaroxaban has been the noted, suggesting that the dose adjustment of the rivaroxaban would not be a required when these agents are the concurrently administered. Anisinidone is a synthetic oral anticoagulant, and the derivatives reduce the prothrombin activity of the blood. It prevents the formation of active coagulant factors second, 7, 9 and 10, as well as the anticoagulant proteins C and S in the liver by inhibiting the protein K mediated gamma carboxylations of the precursor protein. Dicumarol, it is a potent oral anticoagulant that acts by inhibiting the synthesis of vitamin K dependent clotting factors, prothrombin and the factor 7, 9 and 10 in the liver. It is starting to largely replace the warfarin. Dicumarol is produced naturally by conversion of the non-toxic coumarin in mildly sweet clover and a less peja hay or the sweet vernal hay. It is used especially in preventing and treatment thromboembolic disease, formerly called the biohydroxycoumarin. Hello. So in today class, I discuss about the various drug, that is warfarin, anticoagulant drugs. Thank you for watching.